Nicho dorome, nicho mangana mas, nicho pangina nicho getembe, nicho dorome, nicho mangana mas, nicho awana nicho getembe.
Mwancho muligeria lituko ni lya gatatu asumutinyi ukane omwaka chirubere na 2024 kiratigaira matuko chimibere 52 naberuka gukora omwaka uyo moyega o Eastern ogendrete no kwigena kwanenga andonsi asule ebintu mbya bigochirete na nogendrete kwegokia nabo igokwirendete kubwatikana nebinyinyi bya COVID-19 ebigendrete kogosereria obwene noboigo busibule bwabange ensengima na kwariganiria samangana maiya kurwa Getembe Television Network chinsemo cha milimani mwa Kisi unakoletwa asure na inche Denis Ohuru. Tuchakire ase county ya Nyamira abo asabagendi aba boda boda imeye county iyo babuliriye serikali ye county kwene kinganku bwatiranire na barabwo elikurua echanjo ya COVID-19 ase kiroyomo niko bagoteba ng'uburiro bwigamburi ko chora banene gusabake na barabu mbateti kutukumagega asoko bwatisia serikali yenene amune serikali ye county kuruania ebinyinyi bya COVID-19 asamange Onomurikirito bwe county ya Nyamira Ogero Peter.
Abana boda kurwase county ya Nyamira nigo bono banyebolire wizara yobocheno kubwatana na serikali ya county ya Nyamira nse yomugabana we county yomuske amuski momenyalibo akwene kibuna na barabu obuna boda babiri bakonyore chanjo eligwetanga ndwali ya COVID-19 ase obosombi bwabo bwakiralituko
nze samaleta ngoro propi nenanta chairman ya Nyamira sub county Tongo tebya serikali biyamana soparate vaccine ese kiro mondanye ikere ende tonyale to wekonya senja abantu barwalire mono nande kingoteba nga ase bono ga Nyamira ya itoga nje naenda nkabetwa esindani itebwa tieni program negendo keronge gongwa kere serikali biyamana nabantu bonzi genda general ende monyale ko moko betwe sindani abantu bande ko betwe sindani
asama lieta angoro kwa finire ongere okali gotwagire kurigire buya twaronenga boronge vaccine itu ya ye burwa corona yekire yase account itu ya Nyamira igotogota ebyo government itu ya national baenderere gutuma mario goja se account itu ya Nyamira eri tororenga twanyore chanje ya corona kuna boni ese sector ya boda igebwato bakongwo bonene because we are high risk yo kobugoli abantu abatokobugoli igotoko sangi tokomanya ni urware ngotarware ti
amalieta njara nyangao omukadi atende omwana boda kore seji atende ile ntonale kote serikali yetu maana serikali yetu ya county yale kote mamoneto toletere vaccine kuna indwa bagendi ba boda yagere togoldi na banta bange para gaiga toko manyango rwale te corona ngotanye bwati gotwale gotangwa korwa se corona totongwe vaccine yale ko bamyamano
amalieta nenkor kusakari usia monyandiaga
otenga
echemani ya suffering stage vaccine ya konyira abantu bali babetwa na intu nabona boda ese ngenjo toko bokolia abantu abange njiraga tutagete na intu serikali yatoligererie na intu tonyole vaccine ya gora abantu boko na abange muno abora nyola abande batwambukeire
samalieta ngoro kwa mobaza pita nyasani endo mojemani ase sector itu ya family bank boda stage algo saba serikali itu ya county itu ya Nyamira monyala ko bamokolengera linga sector itu ya boda rero nere nebwato bokong ege ko garaiga muna toko batoko imukia ntoko manyango imugetia se pigipigi goro ntobwana to konyole chanje yu na ntumonyala ko bamogotolengereria ege ko gara se tole abana baito batotegemete abangina baito batotegemete none jirani yao ne gotegemete
nguripoti ya Getembe Television kurwase county ya Nyamira lietalia na igonkoro kwa Ogero Peter.
basi bono heko asaba na bodaboda na boigo asugwerigereria na kubwatisia eserikali asisi kiagerekene kiamangana nkiringa ebinyinyi biga bya COVID-19 tibita tie echeche ikonga kiroyo mubuda bana bodaboda bube county ya Nyamira berure twese kwerwa twensi na boturabe tokubwa uburuiro bwa tureteire asare nene asichi sector chionsi chubugima kiagera chiabeire chiko remari wambia mono bono muri kitogero pita kurwasi county yo ya Nyamira togera kuligereria igoro yemiroberio elia serikali yabeka igoro yechipgose protocol igoro ya COVID-19 ansensemo ya matanga niga serikali ya ruguchika nga abantu mbabase kwetania 50 asekero bagusangirekana komo enyo yo mwabo igobono iyo nenchereyemo abange baletange kurua aso kwambukirigwa ebinyinyi ebyo munyakiro gogose omosiyo muyabwe kyombekeria ya Kenya National Chambers of Commerce and Industry yumanyire buna Samuel Matonda ngati yabalia babuata matanga chinga kibune chiga chiabono kubwatikana ku musire tatu mwabo kulenda sensemo ya eni gabolirie balia bakogenda samatanga asenke yo yabo kwene kinga kubwati bale amachikonsi ye serikali na boigo kubolia abakenya kwa jumla kwebwata buya ikiagere binyinyi biga nigo byaletire asare nyinge na kubwati amachikonsi ye serikali
wetera sayo kulingana na ensito ya Kenyere tuwatitia machikaria abekire tunyare kobeka chimaski na koba ale no yonde 1 meter yonsi tuwatiti kulingana na sheria yetu ya Kenya
ngote raiga ubula bwaye igashira ukomotera ukomotera sana na tata tosia
Paul Koinange iyo kiamba igaye ni urero umweshimiwa mugima abantu barengo abantu kisi abantu 50 bono ngo saba bamingi bari mu mpigirereti nima ide mu ati muraba yaro jakoba ngandi kita waida abantu bari go tingu komi na bari bagire somo hapa nchai ekora nima nyete na kororo hongo mugaka gwa dikorera more than 20 dikorera chio ko tiare go jana abantu bamugo kireye me yaro go jene jibasi biri igo mingi tiare go chora kulinda sini je mangana protocol no mutu wanchite no mutu na mutu mwaga ngi ndo banje ndo jitafiyenyu mbuyango basorera ngana mubere chinga muri bindi TV abanje baino morore program yo mugaka kuruka mocha mube munyora nga mugo binga bono ikikori imutoka ko chimoimo ego rati wanjiru muba bange naende tiagasi ya gutumika mwabera bange mwasake machiko into to korosema chikaya nitutotumire na serikali na ande ngo kwakira mbuya mu mushima matiyanyi because nerole ayo masibalia utangaini aso ko make sure ngama chikaya bwatiwe nekero kereka mundu bwate bintu byo gwesiye magoko duba sanitizer ke went to town and did a lot of shopping for that in readiness mapema umwara tu waseti bigeregende mapema ndikuri bitarega ndikuri rike na ndikuri akamenya kwa ono ase bajya batabako to go close family abaguta kwanchirwa bagenda bachikoye n'umwaka mware muroro yabiri nyumba yagakiri yabiri tayari sasa ndaje karakoletu nande garare tukigima na koye ukigima tari guta koletu arare ayi ngumambi yaye machiko na bari banga protocols ya COVID-19 kibwati ngo mwaka guta koletu ruwa mate sagachire kera ikiguga straight agende ndagachwe musimu kutana ko bachita kachinge 1 hour 2 hours max naje bate samachiko bene kama kutana yoere abantu baminto nahoto batabanga bya I trusting the TV ne yamira besi tije tuko kubeka stream live sai da tie pero more simura abande on na mukanya arakuligire ya kike yandrate na bachi media uskine jire me na tie my brothers and sisters barumba bwata basandi babo baranyora nga bateri media bachire igon tutu alekera ase na nutu alechi chi handle simura aligire ni morenga mu program yo mayandi asiri balimu baikire ko etali mokoteba pole bali batatu bane batano babiri bane batano asingi njinga kiyi kuno mwaka arari kama tukaya make ngo batimbu ya muno iko mwakori kenga to ganianga kare gutacha ngo chakora tuli benga tojeti I'm very happy nga mwachire na ndisa nigetenga mwachire na ndi mochi moja na mutu savereneti iko te banga ne kebeteli ngobe bana bacha koranga ntochieti ekyo tikeri kebeteli nga ba take physically Moroji ni mask mbegete inje bali bago jaba kumeti bange mbarandra masia neko garatinda rusi mask. Karongo rusine karongo nyuma maji. Na ande that is it. I have to live by example. Na ande na vita kile kwa hivyo.
Basi bono pole sana oyo minto Matonda Sam kupatikana no kumusiria tatomino. Togo tigana na iyo serikali nigo yabekira machikanda matingwa ayo atangire kinyagitari cyabanyene kurua asokuruwe chanjo ya COVID-19. Nenchira yemo yuko batanga nabo igo kurigereria abanyagitari bali abo bulimo nabo igo barachi gutumika kinjira cyobokora kwenyorera kibesa kubwatikana no kurua echanje iyo ya COVID-19.
The committee noted that the co-participation of the private sector in the vaccination exercise now threatens the gains made in the fight against COVID-19 and puts counterfeit commodities find their way into the Kenyan market. To ensure transparency and accountability in the vaccination exercise and to protect the integrity of the country, the government is effective today closing the window of private sector importation, distribution, and administration of vaccines until such a time when it is confident that there is greater transparency and accountability in the entire process in the interest of public health safety. Consequently, there will be no licensing of private players in the importation of vaccines, and any such license given will be and is hereby terminated. Any person advertising or vaccinating people for a fee will therefore be in contravention of Pharmacy and Poisons Board regulations governing emergency use authorization and the Public Health Act. As such, they will be liable for prosecution. The only agent for vaccination in Kenya will remain the government of the Republic of Kenya until further notice. The government assures those who have already taken their first dose of vaccines outside the government deployment plan by this date will receive their dose when due. All county governments are required to prepare adequately for vaccine deployment, and especially on the use of the IT platform chanjo.ke for data management, increased transparency and accountability. Additionally, all counties are encouraged to step up their vaccination efforts to ensure more of the targeted groups are vaccinated.
Omwelioye omujumbe w'ensemo ya Kiamba Paul Koinange na nigwa lero asenka yigotoka ime y'enseme ya Kiamba county ya Kiambu asumu yega oikeranwa n'abantu 50 boka nigo nonye nabo amanga kwanwa igoro yobuya bwaye nabo igo abange ko motogia n'injira barakiye kuburwa obosemya n'imirimo yae nigo muske Koinange asiri bugema bwaye wiki yaeta kubwatikana no kurwania ebinyinyi bya COVID-19 gati abali abakwana aseberere byo gati abo abana bae ne familia ngima nigo bamotogia tatu mwabo asenchinchira erwete kubakorera emirimo muske Koinange nigari gati abajumbe batano na babere bebunge 12 abo basirire bugema bwabo anene kurwa asuburwire kwa COVID-19.
Everyone. My name is Karuga Koinange, and I'm here to share with you Mze's eulogy. We start with his birth. Honorable Paul Kadesha Koinange was born on July 4th, 1949 in Kiamba, Kiambu County. He was the son of late Noah Karuga Koinange, Maihuka, and the late Jocelyn Modhoni Karuga, Maishushu. From his birth mother, Paul had two siblings, the late Nandeu and Trent Bio, who is based in Florida, USA. From his stepmother, the late Grace Ngina Mashua, Paul had 4 siblings. First, Nicholas Koinange, Mashua Koinange, who is here with us, and Anastasia Wanjiro, and lastly, Ngendo Mashua. Next, his education. Honorable Koinange attended Anglican Church, Kiambaa, Primary School.
Mugavana we county ya Kirinyaga Musubati Ann Mumbi wa Iguru nigabwatukire chimilioni 3.53 ch'echibasari eligo chiago konya aborokigwa bali batali kwenyara niko Musubati wa Iguru abwatukire chibesa ekyo agoteba buna nonyeme chandere ao chinga kichiga cha COVID-19 aganitie abana bagendererie sechisemi
81,000 shillings to assist some of our needy students who are studying in secondary schools, universities, and tertiary institutions. Out of this kitty, 1,615,000 will go to secondary school students, 990,000 to university students, and 475,000 to students in tertiary institutions. The beneficiaries include 11 secondary school students, 18 university students, and 22 college students. The secondary school beneficiaries will get between 5,000 and 10,000 shillings, while university and college students will get between 15 and 30,000, depending on the need of the student. The bursary fund is aimed at enabling students from poor backgrounds to remain in learning institutions after enrollment. Earlier in the year, my administration disbursed about 110 million bursary that benefited 40,000 students. My government remains committed to supporting the education of our children, the improvement of academic performance in our county, and ultimately the lives of our youth. We would like to take this opportunity to wish success to all the candidates sitting for their KCSE examination. As the country continues to suffer from the negative impact of COVID-19, I would like to appeal to all the county residents to strictly adhere to the laid down COVID-19 prevention measures, such as wearing of masks properly whenever in public, covering the nose, washing hands regularly, and observing physical distance. Our county has registered a total of 530 COVID-19 cases since the outbreak of the pandemic, with 436 and 24 patients successfully recovering from home-based care and isolation centers respectively.
Basi bono mwanchu muligeria ngusaba kwabera ase technicality yobuna bagoteba abanyamuriro bono abuno nkali gukolera mangana mayaye chinse chigabere chia bono mukoroba bunengenchere kolende goikankwanira omugano musinini wedakekemo ase mukoroba ya bono natogenda tukomenya ubugimo bwiga kitolemo emechando teri gututiga ubuyamboro n'emechando nero tate kukwanira emechando kero kenda soko kole mirimo igo chandi getaba kuba bao bakoeti murembe kero kende nonye no uro gutenerete takoeti murembe kose nonye naya bari bakora imirimo nse yawo bakoeti murembe kero kende nkagari asomenya to mwamato uri murenere igakoeti imirimo mekongu igakuna gusukiura bebe kiango onye mumenyete no muntu oromorogie chwene igakuna kugochanda kianda ye 10 oirabukia aseke nyorekemo mechando bune yenjale ngo lakini borogi borobumbu alengo mechando tuchi challenges yobolemeru bwechibese obolemeru bwanchani bantu bakuna kurwana nyumba liyo kabantu mbali ke kolemererani mugakoyo munaro linga aseke nyoreke abantu bali kogenda asale bachia kulira asale igali ngumugaka tokotebanga ubwate wisdom ani gali ngumugaka monena ase miaka abantu bakaba bakogenda asale ekero asekero bamotebia emechando yabo tukeli mumugaka yakarangiria abantu bali akabaikaransi abali ngumugaka ura kwane ngana iga abantu baseka akwane ngana ya makaligeria abantu bali bonsi iga akwane ngana ya maseko abantu bagaseka abandi bali batene bagakanse abandi bagaseka bakabakararanse kero bakirire naenda akabaligere akairolere nganeri mbaseke tibonzi bagaseka ngenusu ndekero bakirira akaligere nanda akairorere lya gatatu ano yo motasegete bakamuligere ng'omuntu yo bonongi kiamuri kababuli nungi muko na complain lyo kaba yeme chande memo kero bwatu muchando echi challenge au chubugima okunya ko complain okunya kulira mbiri ko kokonya ento bwate akorankirina ki ligere lingenchira olerwanirere abo bagutumika chinjira chionsi ubwate kurua bwasule ogenderere gusuka mutwe kiamana nkilinga ne bankwagurore suka mutwe neba nigora iro kwagurerenda suka mutwe onyango tarore suka mutwe kenge njo kilinga genderera gusuka sawa bwata ni timu ya Chelsea abwa sendo yo mo boni ko twako ngontu chigoli sano aseibere asegeti kirigia Stamford Bridge ne timu ya West Brom Albion ene Premier League ya Bongereza Leeds United ya kongontre Sheffield United chigoli bera semo Leicester City amona Manchester City niko bali makali bone gachideke 40 saa yani umutimo ko bali half time ekera bono Arsenal paka kuchikumira na Liverpool ase chinsa inye chiabono botuko yobono anya ko mubwatani bwenkoyo ko mwaki korondo ko se gambla Arsenal na Liverpool tingunyara ko tebenga nilio kubekera umutwe kuro kwa Denis boligero lyubya daktari nalensigetega ku Tenacious Herbal Center timati so ikire asichia bisi chetu lakini nkola nginganera toko chikobanera kali kumanyigwa na ven muriango kurumwena linga daktari tayari noara ngojitoreko kwanera oborweire onsaligante biborobo kongusani liete elio gusenga kiri wari kutinkwana nsari kyatinde manyagitari kore ngoro ku Denis oru chikoraga chinsainya nimbega kumanyia ayo na yanda mange asenchira go ikero to skatambe toberega tuganye daktari kurwa Tenacious Herbal Center achie gutumanyia ngalero nduwalikiye tugukwanira